I want to welcome everyone to our seminar today, our Grand Round seminar today. I want to introduce our esteemed guest speaker, Dr. Carmen Navares. And Dr. Navarez is, you know, from the flyers that we've sent you, is a stalwart and a real, I would say, major contributor in the field of public health for several decades now. And as you know, she has a large work that she's done in dealing with issues related to equality, healthcare, particularly work with minorities in general, but in the Latino community in particular. And she now serves as the senior vice president for external relations and prevention medicine at the Public Health Institute, and as you know, is a very large and very influential body. She has worked and has been involved many times with the public health in the state of California. She served as past president of APHA and has worked on numerous projects, both mostly interventional, that have really worked to change the lives of persons, both in the state and the country and in other parts of the world. So, and I've actually known Dr. Navarez and had the real gift of knowing her for a long time, and the pleasure of that. So I'm going to, without further ado, turn it over to Dr. Navarez, who's going to really give us some food for thought, in a presentation entitled "In the Service to the Public, Making a Difference with Public Health." So, Dr. Navarez, it's all yours. You should have screen share ability and so forth. So please move forward.
Okay, thank you so much, Dr. Telfair. So one thing I forgot to mention is that we had some Zoom issues yesterday and I lost my sound. If that happens again, please just start bombarding me with messages in the chat and I will hopefully catch that, and I might have to sign in again, but just know, Zoom's not perfect, I'm not perfect, none of us are perfect, and if that happens, we'll just deal with it, okay?
Yes, we'll do.
Okay, thanks. All right, thank you. So so my name is Carmen Navares, and I am a public health physician, and I'm really pleased to be here with all of you today. We'll think of it a little bit like a seminar, since I know we're not looking at a huge group. It makes it a lot easier for us to have more of a conversation towards the end. So what I was thinking of doing, the way I thought about this talk was sort of how my career has developed and what were the defining issues, and then a little bit in each section about what I learned during that time, and hopefully that will help stimulate your thinking a little bit of kind of the issues you're facing and the sorts of things that you might like to discuss. So I wanted to just do a very quick screen share for a minute because I wanted to talk a little bit about where I come from and what my family is about. Now, do you see my screen share?
Yes.
Yes.
Excellent. Okay, thank you. So this is my father's birth certificate. My father's name was Francisco Nevarez, and he was born, and I'm just reading some things off of his birth certificate because I think there's some nuances of the time that are worth taking a moment to think about. He was born the legitimate child of Francisco Nevarez and Belen Rivas in 1925. His father was an ore laborer, and what that means in the place that he grew up is that he was mining copper. He was working in the copper mines in southern New Mexico. His mother was a housewife, and she certainly had a lot of work to do because she had 9 children who lived. And he was born at home. And I want to just underscore for a minute how they described that. 138 Mextown Street. So I went to the map of Hurley, New Mexico, and Hurley is right on the border with northern Mexico. And there is no Mextown Street anymore. But you also see when you look at Hurley on the map, sort of a fading out of streets as you approach the border. So I can't exactly tell you where in Hurley that he was born, but it might have been the US side, and it could have been the blending side. And the fact that it was named, that he lived on Mextown Street, just really touched me. I hadn't seen that before. And after he passed, I had a chance to look carefully at his birth certificate, and I just found that a very hard moment for me. They were very, very poor people. They escaped Mexico. They escaped because of poverty and hunger. And they came over right before my father was born. He was the third of the 9 children. And he's really the child who had the first child, who is me. So I'm the first child of, it turns out, 44 first cousins. So I'm kind of the one who got that privilege or responsibility. I'm not sure which. And then let me tell you a little bit about my mother. This is my mother's family of all the children who lived. There were, I always forget to count. There were 7 children, 6 children. Yes, there were 6 children who lived. And all of them lived into adulthood, except for Jose, the oldest, who was killed in the war, in World War II. My mother's family was different than my father's family. They came to this country because of the revolution, because of the Mexican Revolution. And they were actually considered to be enemies of the people, because during the revolution, it was a huge land reform revolution. It was a time of war where people were taking over land from the landed, and the landed in Mexico at that time were largely, but not exclusively, people who owned huge tracts of the country and allowed, in quotes, people to work on that land. So it was a sort of serfdom where Mexicans at that time lived and spent their entire lives serving their masters. My mother's family was, my mother's mother was a postmistress for her town outside of Guanajuato in Mexico. And they had, because she was a postmistress and had an education, they actually had a house and they owned some land of their own, but all landowners were sort of looped in the same bin. And so they escaped barely with their lives and came over to this country. It's very hard to get the real story of who was killed in our family and who made it here. My understanding is that 3 of her brothers were killed during the revolution in front of the children by the revolutionaries. So on the one hand, it's a family of privilege, and on the other hand, it's a family of poverty. And amongst those children, the children of those children, as I said, there were 45 of us, and I was the firstborn within that group. So I'll stop sharing my screen now and just sort of go back to thinking a little bit about why that matters. Well, it matters to me because my town was not was actually a poor town in Southern California. It was a poor town. The economy was about agriculture, mining, and the military. It's now become a suburb of LA, although being 80 miles away from LA, it's hard to imagine how that could be a suburb. But if you know California at all, that's sort of how things go. LA creeps. And it just gave, coming from a place like that and going almost anywhere else really gave me a chance to think about what am I here for and what is my purpose? My father was a mechanic, and my mother, thanks to the oddities of how things evolved during World War II, became a nurse. She was going to be an army nurse, and then the war ended. And so she didn't end up going in the army, but she was a nurse. And so she had this career, which was an amazing idea, because of all those other brothers and sisters, there's only one other who had a career that had anything to do with getting an education. All of the other brothers and sisters in both my mother's and father's family basically worked in one way or another in the service industry. So I was a very special child, and I was an only child for a long time for various reasons. And so a lot of attention came my way, and a lot of hope came my way, and a lot of dreams came my way. So at a very young age, I realized that I was supposed to be a person of service, and that I was supposed to go out in the world and do good. and that I was supposed to have a career in an education. And because my mother was a nurse, the next logical thing that everybody said was, you know, are you going to be a nurse? And my mother would say, no, you're going to be a doctor. So that was set. At a very young age, it was decided that I was going to be a doctor, even though nobody knew anybody who was a doctor or had any connections to anybody who was a doctor. It just was decided. And so that's just what I knew I was going to do and what I knew I was going to be. And it turned out to be quite fortuitous because it fit. It just fit what I was thinking about and what I was doing. In high school, I was sent to Catholic schools because I come from a very Catholic, very large Mexican family. In Catholic high school, I was good in science and I was good in math, and that set me aside from all the other girls who did what they did with the stuff that they did. And in some ways, you know, it's good to be it's good to be odd. It's good to be it's good to be a nerd. It's good to be the person who does well in school and likes school and is really having a good time with school. And it gave me a lot of opportunity because in a school like my school, which very much focused on both scholarship to a certain degree, but also the social stuff that I didn't get involved in, I had a lot more opportunity for moving on in the educational system because there weren't very many of us who were really, really dedicated to making a mark within those institutions, within the halls of education. So I ended up at a college within the University of California in San Diego at a very, very critical time. That school was founded by Angela Davis and a number of other thinkers within the Black Power movement and the Brown Power movement who were thinking very hard about what does a world look like if we are able to educate young people in thinking about social justice from the very beginning, thinking about their histories from the very beginning, thinking about what they need to do in this world to make it a more just and equitable world from the very beginning. And so I ended up in a school where we were learning about, in our humanities class, we were learning about the histories of the countries that our people had come from, and we were learning about the social and political movements that shaped that time, and we were learning about we had many people within our educational field who had marched. And the marches had happened while I was the marches in Selma, the marches in the South had happened while I was still in grade school. But the memories were very, very strong, and we were never allowed to forget them. And that's who we studied in college. Our main books were books written by Malcolm X, and books written by Martin Luther King, and books written by Cesar Chavez. And fortunately, my mother had been very much along these lines when I was a kid, because she had me in the summers working for the Farm Worker Union. So I had already kind of had my taste at a fairly young age of thinking about, how does this all tie together and what my purpose in life is. I'm still privileged to know many of the people that I went to college with, and to say that we have all in one way or another ended up in that service to community, in that service to the public, whether that be the law, whether that be education, whether that be medicine and health. We've all ended up doing that. And I'm really pleased that we made that community and we made it stick and we've stayed together, because that was a long time ago. And it's good to still know people who knew you back when, who can say, don't get that way. Because it's important to be reminded of where you come from. We had our opportunities, many opportunities to be tear gassed. We were in I don't even know how many mass actions and demonstrations. And this was all at a time when the whole idea of militarizing the police was happening. So before we were involved in this work, the police were just, they were beat cops. That's what they did. During the time that we were in San Diego and we were doing the work that we were doing, there was a very strong commitment to quashing student uprisings, and the police became SWAT teams, and the police got helicopters, and the police got assault weapons, and the police got tear gas, and the police got uh, elements of crowd control that they had never had before. And they used them on students on a regular basis to keep us intimidated and to keep us, to keep us in line. Fortunately, I never ended up in jail, although a number of my friends and colleagues did, and their career paths were definitely changed. And off to medical school, I thought that I was going to go, when a week before my trip back east, because I ended up being accepted to the University of Minnesota. A week before school started, I was driving my car on the freeway and I was hit by a truck. And I had a very severe concussion. I did not have health insurance. I was taken to the emergency room and held until I regained consciousness. And then they sent me home. And I was really very disabled. And I don't know how many of you have had concussions, but my concussion kept me out of communication for about 3 days. I have no recollection of this, but we did know somebody through our pre-med connections who knew somebody who was a neurologist. And I was taken to see that neurologist, who said that probably I would be okay. And so off to medical school I was shipped, even though I had very limited verbal abilities. I had no ability to acquire and retain new knowledge. I had a good recollection. So I could remember the subject matter of everything that I had been taught at school, but I could very easily lose the thread of a conversation just a minute or two into it. And this went on for a fairly long time. This went on for months. One of my biggest regrets is that I didn't know that there might have been an ability to take a year off. And I bring that up because I think one of the things that has been a big stumbling issue for me has been the paranoia that I developed during that time, because I almost flunked out of school. In the first year, I failed every class except for one, even though I had tested out on the very first day of registration of embryology, because I'd had an embryology course. So I remembered the material and I took the test and I passed it just fine. All the new stuff, the anatomy, the physiology, the things that I hadn't taken before, I failed every single class. I passed pharmacology, which I'm sure had everybody scratching their heads, but I'd had pharmacology as an undergrad, so I knew quite a bit of it. And then I made up all the makeup exams in the second semester, and at the end of the year, they gave us another chance, and I passed them all. But the point is, when you spend an entire year not knowing, who's out to get you, is somebody getting ready to kick you out of school? Is this a teacher that's going to be friendly and supportive? And in a mental state in which you don't really know how disabled you are. And I didn't really understand how altered and disrupted my speech patterns were. So within that environment, I still made it through the first year of school. I did fine in the second year and the third year and the fourth year, but I kind of carried with me a huge chip on my shoulder, which was paranoid driven, and made it very, very hard for me to recognize who was there to help me and who wasn't there to help me, and to really discern what my opportunities and my options were. So got out, got into the residency program that I really truly thought that I wanted, which was women's health, OBGYN in Oregon, moved to Oregon. And then my mother died right in the middle of that transition. My mother died, and a very, very close friend of mine died very suddenly. I went straight into the residency, shoulder to the wheel, just kept going. And I just kept thinking, I have to keep going. I have to keep going. I have to keep doing this. I don't have time for these emotional things. I just have to keep going. This is my only chance. When you think it's your only chance, sometimes you act in very desperate ways. And I acted in that role for a year until finally I just hit a wall. And towards the 10th or 11th month in my first year of my residency, I just realized I couldn't do what I was doing anymore. What I had been doing in obstetrics and gynecology in the late 70s was restraining women, basically tying them down until they had their babies, yelling at them not to scream, just like everything I saw around me. And I realized how, at its very core, how wrong that was and how much I did not belong doing that, and how I had made a dreadful decision to go into obstetrics and gynecology, where I thought I was going to be helping women, into a place where I realized that I was oppressing them in the worst ways that women are oppressed. So I wrote a letter to my residency director and I said, I've had it, I'm out of here. And they said, well, if you could just hold on for another couple of months, we can let you go and we'll take you back. But if there's another guy who needs a couple of months off. And I thought, well, it's probably better to go being thinking that I can come back than just go now and not even have an internship qualification, which would make me qualified for a license. So I stuck out that year and did another month and a half, and then I just left town. And I moved from Portland down to San Diego, where I had gone to school and where I knew people and where I had friends, and I had no idea what I was going to do next. Got a part-time job as a physician in a health center, and then rediscovered my connection to community health. I had been involved in community health before. I had been involved in a neighborhood health center, and they had no medical director. And I thought, well, sure, I have an MD. What do you need? And I stood up and I went in and I did that. And that's where I started to learn about systems and structures and accountability and who you are in the community. Because the first thing that happened was that the medical society came down on us and decided they were going to shut us down. And so I thought, well, okay, I'll go to your meetings and I'll justify who we are. And as I'm standing in line with this other doctor who's, talking down his nose to me about, how they just want to make sure that there are good doctors and good medical practices happening in a community that they didn't even care to serve. He says, well, so where did you go to medical school? And I said, University of Minnesota. He said, Minnesota? Well, that's where I went. Whoa. And then that's where I learned that, sometimes having this brotherhood, this fraternity of people who associate themselves with this or that institution is actually pretty important, because it got them off our backs. Just that one statement. I gave my presentation. They said, anything we can do to help you, just let us know. You're a real doctor. We know you care. We know you're well trained. And I thought, okay, that's good to know. And I went back and I learned even more about what kinds of systems are required, what kinds of accountability. You can't just have drugs on a shelf. You have to actually have procedures. You have to have ways to safeguard. You have to have ways that enable you to be there when people need you. You need to have staffing. Where do you get that staff? How do you train that staff? All of those things were things that I was just learning completely because I was thrown into it and because that infrastructure wasn't there. But we saw lots of patients, we did lots of good, and I got an opportunity as all of that developed to see the context of that time was that AIDS was starting to be identified. San Diego was the second largest hotspot of HIV/AIDS, right behind San Francisco. And there's lots of reasons for that, but there we were, and it hadn't yet been identified. We didn't know what it was, and lots of them were coming to us because we were non-judgmental, because we had a clinic that was there to be there for what people needed. And lots of young men started coming to us, and we were scratching our heads all the time. What's going on here? What is this deal? So I found some friends that were willing to come over from the university, and we started a gay men's clinic. And just about then was just about the time that I finished up there. I we had a fairly good understanding that HIV was a virus, that we started to understand its the associated conditions with it, and we started to understand prevention a little bit better. But it was one of those. It was just one of those opportunities. It was something that happened kind of, that I just sort of stepped into, and I had no idea we were going to be in the middle of uncovering uncovering some of the roots, some of the behaviors, some of the relationships, some of the social conditions that made it very, very easy for this virus to become the scourge that it became. This also gave me the chance, being in that position gave me the chance to be noticed by somebody in the local county health department who came over to me at a meeting and said, I think I'd like to just see if you'd be interested in coming over to work with us. We're starting to implement a county-wide information system for all the community clinics, and we need a doc. We don't have one. We need somebody who understands how medicine works. And I thought, well, anything that makes us do our job better, that connects us information-wise, this is good. And of course, here's the nerd coming out of me, because I'm thinking, wow, this is really kind of cool. And so I got a chance to be part of a team understanding and analyzing how do you build those systems of communication for information flow, and what do we need to know about utilization patterns? What do we need to know about what docs are doing what to whom? What do we need to know about what it costs the local government when medicine is practiced poorly? San Diego is a very large county in California. It's the second largest county in the state. It covers a huge amount of ground. And the county health department, many years before, actually the county government had sold the county hospital to the university. And the agreement was the county would pay the university for the care. Well, the costs had gone through the roof. And so our county and two other counties that had done the same thing had gotten together to talk about how to understand better how to control costs. And of course, I know that since you're all in public health school, you think about this a lot, because we do have to think about how do you use your resources wisely. And so I got the job then of traveling up to Sacramento, where all the records were kept of how all the money was spent. And started to look straight into the databases to get a sense of what are the things we need to know? What are the patterns? What are the trends of care? We found all kinds of pretty weird stuff. We found 10-day admissions for earaches in children, where there was no other complicating factor, no other underlying condition. And yet the hospital and the doc had been paid for those 10 days of care. We found similar patterns in all kinds of areas. And, and again, this is the nerd in me coming out saying, this isn't quite right. What are we going to do about this? And so I got to be at the beginning of thinking around organized health systems and organized health system data keeping, and how that data might help you to better develop policy around what government should pay for and what government will pay for. It got me to think about how government, in fact, really does allow, permit, support the good stuff to happen, and how it can, when it pays attention and understands the link, can help to prevent some of the bad stuff from happening. And so I got to have a pretty healthy respect for some of the very, very good work government can do. I also got to see some of the abuses of government. And so having that opportunity was really, really very valuable for me. From the community health center and the local government situation, I ended up being introduced to the possibility of preventive medicine and public health. Because up to then, I didn't know that I was doing anything that had to do with public health. I thought I was just doing healthcare. And a friend of mine invited me to an American Public Health Association meeting in Los Angeles, just because he said there was going to be a big party. And I thought, parties, great. I love parties. So I went to this meeting, and as I was at this meeting, it was in Los Angeles. This was around 1983. I was at this meeting and I just kept looking around and listening to what people were talking about. I thought, actually, these are the people in health that I really need to have. I need to be around these people. These people are my pod. This is where I belong. And that changed my whole life. And that was when I went into preventive medicine and got a preventive medicine residency and just completely changed the trajectory of my work and what I was thinking about. And after doing a preventive medicine residency with the state of California, which actually ended up putting me in the office of the director of health for the state of California, and right up next to one of the real heroes of public health, Bev Myers, I got this great opportunity to see what does it look like from the top, having been at the ground to sort of the middle ground, and then all of a sudden at the top, and thinking about how should government be thinking, and what does government think about, and what should government be thinking about. And I got put on some advisory committees, and just kept getting more and more involved in the various ways in which community health centers mattered, and the organization of them mattered, and payments for health centers mattered. And then I started to get into local public health in a more formal way. Leaving the state residency program, I was then brought in as the public health officer for the city of Berkeley. And that's where UC Berkeley is located. And you may not know, but California has 59 county health departments and 3 city health departments. And Berkeley is one of those. The cities are Pasadena, Long Beach, and Berkeley. And the history is that they already had health departments before the county health departments were started, and they wanted to keep their health departments after the responsibility for indigence and local public health responsibilities went to counties. So I became that city health department's public health officer, and then, because of circumstances that I'll mention in a second, became the director of the Health and Human Services Agency, encompassing homeless jobs program, food programs, regular public health, environmental health, mental health, and recreation programs. So Berkeley has 100,000 people, which isn't huge by California standards. It's kind of a mid-size jurisdiction, but it still is a pretty good chunk of folks. And during the time that I was there, HIV/AIDS was just roaring in terms of its importance. Homelessness was becoming a terrible problem, and tuberculosis outbreaks kept happening over and over. And that was right about the time where we started to get multiple drug-resistant TB in that population, along with HIV hand in hand, and IV drug use, and all of these things bundled together. And these were some of my responsibilities. At the same time, we had civil unrest that was really starting to, to sort of tear apart the community. There were some very good reasons for it. There were reasons around police brutality. There were reasons around the university and its unceasing march to land grab, and in doing so, take away low-income housing and destroy neighborhoods. And there was a huge amount of outcry about that. And then we had the mass disasters. We had the Loma Prieta earthquake. We had the Hills fire. And both of those happened, one right on the heels of the other. And for those of you who are around, the earthquake happened, I think, 6 minutes into the first game of the World Series between San Francisco and Oakland baseball teams. That earthquake was massive. It happened 100 some miles away, and yet completely leveled an entire freeway, causing it to collapse down on the lower level of that freeway, and people were trapped in cars there for days. It was an ecological disaster. It was an environmental health disaster, because the places that were the most impacted were those industrial areas that were right on the edge of poor communities. So there were massive spills, and there were fires bursting in the middle of town in Berkeley, because in the auto shops, chemicals tipped over, ignited, and erupted into flames. So all of this happened during my tenure. And I got an even closer up look at how government works, about how regulations happen and why they are important. I learned a lot about environmental health regulation. I learned a lot about impact measurement and why impact measurement is so important to policymaking. Berkeley is a government where things happen on the ground, which is true of all local government, but this is a place where easily 150 people will show up to a local council meeting and have their say, and easily have all of their say, and take up, we could be meeting till 2 or 3 in the morning. So my lessons there: don't silo. You need to learn as much as you can about everything you can, and don't turn down opportunities. Be there, be present, be counted, and get the opportunity to link to everything that you can. And then that goes along with the fact that leaders have to hold complexity. And that, more than any other time, feed to the fire, that was leaders have to hold complexity. After 5 years of that, I got pneumonia and couldn't shake it, and just couldn't shake it. And finally said one day, if I want to live, I have to get out of this job. So I left my job, not knowing what I was going to do. Felt a little bit like I felt when I left my residency, but got picked up fairly quickly and ended up in Public Health Institute, where I've been since, for over 25 years. They needed a doc. They wanted a generalist. They wanted somebody who understood about local government, and they wanted to know how they could be more influential in working with local government. So what is Public Health Institute? It's a nonprofit. It is all grant funded or contract funded. It has no money of its own. It doesn't generally make stuff and sell stuff. It doesn't have an endowment. We work with government usually and with foundations to get the work done that we both feel needs to be done, and that government needs to have done, and needs to have done quickly. What have been some of our defining issues? The budget crisis. California had a massive crash during the budget crisis, and services were cut off to funding was cut off to all kinds of services. Well, this was an opportunity for us to get in there and make a case at the state level for why certain services saved you money. Unfortunately, we had a bit of a positive year in the legislature and with the government. And the most important thing that I can turn to is that we were able to refund teen pregnancy prevention services simply by drawing the trajectory of what was going to happen if we stopped providing those services, in terms of what would be required for more educational costs, more lost wages costs, more costs of education that would be lost to parents who had to drop out of school because they were needing to be parents at a very young age. And just pulling that out and pulling the analysis together and making that presentation made a massive difference. The teen pregnancy prevention program was turned around and got the only budget augmentation during that period of time. APHA happened to me during that time. And APHA, I had been involved in APHA, but being elected president of APHA gave me both the opportunity and the responsibility of visiting ultimately 22 states and talking to them during the time that the Affordable Care Act had just been signed, and we were trying to help people understand how the Affordable Care Act might help them at the local level and at the state level to move health equity forward. It gave me a chance to learn how to be that kind of a leader, a kind of a national leader, and to take that stage. And my most recent work has been as a result of the opioid crisis. I had already been working on leadership, and we had gotten a contract to run the leadership program for the CDC, which is founded on a notion of building leadership teams that are intersectoral and that work on issues that are important to them, but where we bring them the opportunity to learn how to be leaders within that environment, and to learn how to be accountable and transparent, and to use communications wisely, to understand what data they have and how to display that in a way that helps to drive policy, and how to be sustainable. So because we were running those programs, it made sense for the state of California and some of the foundations to also invest with us in the area of bringing those same strategies and tactics to opioid coalitions, local opioid coalitions. So I'm now working, doing leadership development, although we don't call it leadership development, we actually call it impact work, to local opioid safety coalitions. We're covering about 80%, 83% of California's population, and have now launched this nationally. And then there was COVID. So COVID has been a really important defining opportunity for us because it really tested our ability to be nimble, to be transparent, to be sustainable. And at Public Health Institute, it gave us the opportunity to stand up to some of the challenges where local government just simply couldn't meet them fast enough. So we have, in the last year, doubled our size. We doubled our size in our budget. We doubled our size in our personnel because we're running contact tracing programs for a lot of the counties in California, for for the most populous areas in the state of Oregon and in the southern part of the state of Washington. We're moving those services out further. It's all virtual work, of course. But so it doesn't matter where you live. What matters to us is that the people we have hired are trained, that they are at least bilingual, that they meet the needs of the people who are on the ground and who need the assistance of learning about COVID and knowing what they need to do in order to protect themselves and their families. We're now migrating that skill set and that reach into the area of vaccination and into the area of food programs, because when you look at any public health crises, it's all about the social determinants. So food, shelter, housing, education, jobs, and health, all of those things tied together. And the real joy of being in the job that I'm in right now is the fact that we get to do that in a very, very robust way. So what I've learned here, relationships are critical. You don't get this kind of reach unless you have relationships and people know you and they trust you. Being there and being counted absolutely matters. And I think more from the work I've done at leadership than anything else is that you accompany people on their journey and you help to support them. You do not empower them. They empower themselves. And that's a very, very important lesson for all of us, I think, in humility. The big lessons, well, number one, keep your anger. Use it as your inspiration, but don't let it destroy you. The second is you need restorative practices. Mine are photography, music, friends, family, community building. Holding my cat. If you were on early, you saw that my cat wanted to be held, and I gave her strokes. Riding my bike and watching the sunset. And I swear this watching the sunset thing is actually really, really important. And the other thing is looking for shadows, because the shadows help you think a little bit about what's there and what's not there. What are the contrasts? What are the forms and the shapes? And sometimes that just really helps you be grounded and being present in the moment that you're in. So in reflecting and thinking forward, I guess the biggest lesson for me is get to the table, because I'd rather be at the table than be the dinner. And the thing that I've learned, because I am Latina, because I'm from the kind of family that I'm from, because I'm not from a medical environment, straddle both worlds. I've always had to straddle both worlds. And that's a really, really good skill to have. Sometimes it's how people come to you because they recognize something in you that relates to something that they are, and they can make a connection into a world that they might never touch or get a chance to touch, because they know that you're kind of one of them. Find your story and tell your story. So having done that and having a few minutes left, I wonder if there's any way in which we could have a conversation.
Thank you so very much. So we now have the opportunity, if you can either unmute yourself or and turn your camera on if you so wish, to just have a conversation about what Dr. Navarez has shared. It could be anything she shared.
Yes, I want to thank you for sharing this story. It's very, encouraging. We all go through some, obstacle in our studies, but we made it. I also got my degree in preventive medicine. So, in fact, I'm biostatistician, but the department was preventive medicine, and they refused to change my certificate to be biostat because the department name was preventive medicine. So, but I didn't know much about preventive medicine anyway. But you have a very productive, really, career, and getting involved in public health. This is the ultimate goal for everybody to save the public and preserve equities and disparities on all this. So my question is, your research usually in medical research, but did you do some work in like some research in public health in general?
Well, most of my research has really been uh, thinking about how I don't have a specialty, but I've written in the areas of uh, Latino health, and particularly teen pregnancy prevention strategies. So if you looked me up, you would see a number of things that are related to chronic disease prevention, teen pregnancy prevention strategies, funding of teen pregnancy prevention. You would, what's the most recently, what I've been working on are pieces that look at health equity and and explain or argue why health equity is critical to our economic survival. So I'm less of a researcher and more of a commentator and more of an interpreter.
I
And
see.
and I think that really uh, standing on the skills and the scholarship that other people bring into the field, and just sort of trying to make the linkages and trying to see why what is happening in economics and what is happening in community development and um, and education, why that all strings together, and just what it takes us to move forward as a country. And I think sort of even more recently, if you if you do a search, I think there should be an article in the American Journal of Public Health that I helped to publish about democracy, because democracy is democracy, voting rights, engagement, participation. Those are all fundamental to health. And so what my job is, as I see it, is to help write about and lift up the ideas that participation is how we make a healthy and sustainable world.
Absolutely.
And,
I will
and
look. I will
that's kind of
definitely will
my,
look you up because I'm interested in teenagers prevention, pregnancy prevention. So really, it's also abortion. Some work on abortion. So
yes.
thank you very much.
I,
Thank you very much.
I think maybe the other thing I didn't go into a huge amount of detail of that work that I've done, but I think that there is a tremendous amount to be learned when you think about what um, what is it that children need in order to make a decision, because this stuff doesn't happen by accident.
Absolutely.
I worked as a gynecologist. I didn't even talk about this, but I worked as a gynecologist for almost 40 years. And the young people need purpose, and they need a reason, and they need a visual and a heartfelt connection to what their lives can be if they can put off being a parent, especially
Absolutely.
now, because so many
Absolutely.
methods of birth control are available. But
Yeah.
then, we could have a whole nother conversation about that.
Yeah, absolutely. I mean, very interesting area, and I think, yeah, if we invest in our youngs, that would be a good future, as you said. I mean, if we forget about this segment of population, we will be doomed if they are doomed too. So I
Yeah.
think we have to work hard in this, because it's my passion to work with children health and youth health as well. So most of my work in this area too.
So I think that the other thought I would add to that is that when we were working on the teen pregnancy prevention funding issue crisis, my thought that I shared with my colleagues was that we needed to go to the Latino Legislative Caucus and work with them directly. And everybody said to me, oh no, they won't want to be, they won't want to touch that topic. They wouldn't, they're anti-abortion, blah, blah, blah. I said, they're not anti-abortion. That's bullshit. And I also said, what they care about, first and foremost, is that children will be educated and children will be able to achieve something with their lives.
Absolutely.
So that's what we ended up doing, was that I went directly to the chair of the caucus and I said, here's what's important. And here's what we lose if we do not continue to invest in our children. And she
Absolutely.
said, oh my God, we have to be out there. This is our issue. And the whole caucus sponsored the bill to provide more funding. And that was just,
Wow.
so what people thought was going to be conservative opposition ended up being a very strong support. And they were in the news with us, and they just were amazing.
Yeah, absolutely. I agree with you. I mean, we have to keep working, focus in these areas. Thank you very much for your
Yeah.
sharing. Bye bye.
Thank you for your thoughts.
Others. Okay. Any closing comments, Dr. Navares, you want to make before we end our session here?
Well, there have just been so many things that happened, and I think that at the bottom line, um, when you think about what you do, and when you think about what you want to look at, sometimes sort of being able to be flexible, being able to have a plan, but a plan that can be massaged, a plan that can be that can adapt. Things change. You don't expect them. I never expected an earthquake. I never expected a fire right after an earthquake. I never expected a car accident. I never expect. There's so many things you don't expect, and to get derailed in all of your plans means that you need to have a plan with options, and your options always have to allow you to be open to whoever your friends might be who have the same goal in mind. Set a very broad table, invite everybody that might be able to contribute, and listen to what they say, because their way of doing things might be 10 times better than the things that you've already thought of, or the things that you think that your science has driven you to. And that when you dig a little deeper and uncover a few more levels of facts and of thinking and of trends, you might find that the things that come from entirely outside of your own area or your own discipline or your own study are the things that work the best. So, it's the keeping an open mind, it's having a plan and having a plan with options. And the options always have extra options you didn't know about before you started.
Thank you. Well, on behalf of us here at Georgia Southern, we really want to thank you for your time. I know how variable it is, and I'm sure we all do. We want to remind people we have one more seminar coming up. It's with our own Dr. Swin and her colleague, and we will look forward to seeing everyone. So, Dr. Navares, you have our gratitude, and we thank you for your time and your effort. And we want to thank everyone for attending. And as usual, we will have both the the recording itself and the transcript from this great presentation, and we'll be posting it on our site under our seminar column. And please follow up and let other people know. Anyway, thank you, Dr. Navares. Have a good rest of the week, and I'll be speaking with you.
Well, thank you so much. I really, I enjoyed this. It was a good preparation. It was a good.
Absolutely.
Thank
You gave us much to consider, much to think about, and just a really great appreciation of what we do.
Thank
Take
you
care.
very much.
Okay.
Okay.
Bye.
Thank
See
you.
you soon, Joseph.
Okay. All right. Take care. All right.
Bye-bye, everybody.
Bye.
Thank you.